Hi. Uh, Today's topic we'll discuss that is a whooping cough. So whooping cough also known as pertussis. So whooping cough that is a highly contagious respiratory tract infections, or that is a highly contagious respiratory illness caused by Bacterium Bordetella pertussis. And this whooping cough is a bacterial infection characterized by severe repeated repetitive uh, cough, coughing fit, often accompanied by a distinctive whoop sound. So whooping cough, the other name, that is pertussis. So let's see the definitions of the uh, whooping coughs. So whooping cough or pertussis is a highly contagious respiratory disease or highly contagious respiratory tract infections caused by the bacterium Bordetella pertussis. It is characterized by severe coughing fit that can end in a whooping sound when the persons breathe in. Okay, so that is the definitions of a whooping cough. Next we'll see the causes of a whooping cough. So here main causative agent or main causes is a that is a Bordetella pertussis bacteria. Okay, and transmissions, so it will spread to the respiratory droplet when an infected person's cough or sneeze, and also be contacted by touching contaminated surface and touching the face. So it can be transmit. So these are the causes. And next we'll see that is a risk factor. So what are the risk factor of a whooping cough or a pertussis? Like a vaccination status, age, and close contact, immunocompromised individuals. Okay, so these are the risk factors. I mean, vaccination status means here those who are uh, not fully vaccinated are at uh, are at high risk. And age, infant, those who are age group, age infant and young children are particularly vulnerable. And close contact, so in close contact, living in crowded conditions or close contact with infected individuals also increase the risks. And next, immunocompromised individuals means here those with weakened immune systems are more susceptible. Okay, so these are the risk factor. Next we'll see the uh, sign and symptoms of a pertussis or whooping cough. That is initial symptoms. So in initial symptoms, runny nose will be there, uh, mild cough, low grade fever, sneezing. So these are the symptoms will appear in a initial symptoms. Next we'll see that is a next stage, that is a paroxysmal stage. So here severe coughing will be there, whooping will be there, whooping sound when inhaling after coughing, vomiting after coughing fit. Okay, so these are the signs and symptoms. And next we'll see that is a in convalescent stage. Convalescent stage, here gradually recovery over week to months with decreased coughing. So in this stage a little it will decrease the coughing. Okay, so next we'll see that is a diagnostic evaluation. So in diagnostic evaluation here, first of all we have to do that is a history collections and physical examination. Next test we have to do that is a laboratory test. So under the laboratory test we have to do that is a PCR. And next is a culture of the bacteria from a nasopharyngeal swab. Next test, that is a serology test. Next we'll move medical management. So in the medical management here we provide antibiotics such as like uh, azithromycins, erythromycins for treatments and to reduce the contagions. Next uh, is supportive care. So in supportive care, cough suppressants are generally not recommended, but hydrations and rest are important. Okay, hydrations and rest are important, and hospitalizations may be required for infant or severe cases. So these are the medical management of a whooping cups. Next we'll move in nursing management. So in the nursing management we have to monitor, okay, monitoring, observe respiratory status. We have to observe the respiratory status and watch for the complications. And next, patient's education is must required, supportive care is required. Okay, next, infections control. So we have to implement the precautions to prevent the spread of infections in healthcare settings. Okay, so these are the nursing managements. Next we'll see that is complications. So complications here, like in infant, apnea will be there. Okay, pneumonia, seizures, weight loss. In adult, we can see like a rib fracture from severe coughing, exhaustions, potential for chronic cough lasting for months. So these are the complications of a whooping cups. Next we'll see that is a preventions. So how we can prevent these whooping cups. So vaccinations and public health measures. We have to promote the awareness and vaccinations campaign to prevent outbreak. Okay, so these are the preventions of a whooping cough.